This will be a demonstration for the only FDA cleared automated subglottic aspiration system, Simex. It comes with a couple of disposables. It comes with a liner for the canister with a solidifier inside, and that liner is placed inside a plastic canister, which is not a disposable. You want to make sure it's securely clicked in place. Then you get the only sterile piece of tubing with the system. The clinician opens it on bedside, grabbing, never touching the end, and attaching the end of the blue end to the canister. You then attach the sterile portion of the tubing inside the subglottic port firmly but without force. This tubing here is a special ET tube with a subglottic port, allowing for aspiration to happen above the cuff instead of going down into the lungs. You can also have a trach with this subglottic port. So either a trach or ET tube with subglottic port. We have a commonly accepted algorithm. The account will choose their own algorithm. The algorithm that you see here is commonly accepted. And as you can see, all the defaults are at 200 millibars or at 150 millimeters of mercury, which is the highest recommended AARC pressures for an adult. And how you use the machine is you turn it on. The minute you see Simex, you simultaneously push the arrows. And as you can see, you need to arrow either to language or parameters. We're going to arrow up to parameters and hit confirm or OK. This is set for 30 seconds on. That's usually the algorithm for viscous sputum. Wall suction only goes 15 seconds on, 15 seconds off, allowing for the mucosa to dry. Also, with the 30 seconds on that you can with Simex, you can allow more viscous sputum into the tubing. Simex goes anywhere from 3 to 60 seconds of aspiration and 10 to 60 minutes off. So we're going to hit OK for the aspiration of 30 seconds on. And let's say that there's a lot of sputum and they want to suction much more often. Let's say 5 minutes. You arrow down, you hit confirm or OK. 200 millibars is the accepted. If it doesn't need 200 millibars, I am now going to show you how the pressures back off when sputum is dissipated, and it won't even go to 200 millibars if it's not needed. Do not do this with the sterile piece that goes to the patient. This is for demonstration purposes only. We're going to turn it on. We're going to block the end of the port. And if you notice, the pressures will go, this is needing the 200. Now, when sputum has dissipated, look at the pressures drop off. So it backs off automatically. This allows a higher safety for the patient that allows higher pressures and gets more sputum out than wall suction. And if they ask you why it never goes to zero, because you don't want backflow like a wall suction. A wall suction is actually contraindicated mostly because of the backflow, and it's very vector oriented. To pause, you hit OK. It goes yellow. Green is on, yellow is pause. And if it goes 15 minutes with it on completely, on and off on its normal cycle, or if it's on pause for 15 minutes, it will lock you out. To unlock you out, you hit both arrows simultaneously. And then you hit OK. If you pause and want to change the pressure, let's say you want to unclog, you can pressure up to there without turning the machine off. And go. Put it back down to 200 afterward. And then if you want to change, let's say you notice it's no longer viscous and you want to change the settings altogether, you have to turn it off and start all over. And that concludes our demonstration for Simex.